Hi, I'm Dr. Lisbeth Roy of Doctor's Studio. Thanks a lot for joining me. I want to talk to you about a new technology, new to me, new to this country, for men who have erectile dysfunction. It's shockwave therapy or pulse wave therapy. It's the delivery of sound waves to a prescribed and specific depth and frequency that actually stimulates the regrowth of blood vessels. So the first thing to have happen is the blood vessels open. The next thing is the regeneration of blood vessels. And so we know that blood flow is the most important aspect of erectile function and having robust erectile function. As men become affected by erectile dysfunction, there's typically a decrease in blood flow. Sometimes there's a decrease in sensitivity as well. And so there are men who are fast responders, meaning right after the very first treatment, they'll see some changes in their sexual function. And that's because the blood vessels have now opened. And then over a longer term, we have the regeneration and the regrowth of those tissues. There are men who respond a little bit slower. Those are guys who have significant dysfunction. Maybe they're dependent upon injectable medications for erectile function, and we truly need to regrow some tissue and regrow some blood flow. So it varies, but everybody gets a benefit. I love to really announce the fact that we can treat Peyronie's disease, which is curvature of the penis, with this technology as well. So as you know, at Doctor's Studio, I am a sexual wellness expert. I treat both men and women. I use functional medicine, which is an investigation of the underlying cause of the problem and then fixing that underlying cause. We have bioidentical hormone therapy. And again, that takes expertise to really dial that in for maximum benefit. Lots of nuances there. We also have a lot of compounded medications that I can customize for you and your use. I have the technology PlateletRich Plasma, and you've probably heard me talk a lot about PlateletRich Plasma. In fact, I have a book called Regenerating Sexual Potential, and that's all about these different tools, including PlateletRich Plasma. The shockwave or extracorporeal shockwave technology, we call it Gainswave, is new to me, and it adds significant benefit to everything else that I have to offer. I'm going to turn on the machine so you can hear exactly what this sounds like. It's truly sound waves. It's the same type of technology that breaks up kidney stones, and that's often used for plantar fasciitis. And so just like platelet-rich plasma can be applied to lots of problems, this pulse wave therapy can be applied to erectile dysfunction. I'm also using it for women, which I'll talk about in a different video. But this is what it sounds like. This is the handpiece, if you will, the gun that's actually delivering the sound waves. This is a transducer. And so we dial the number of bars, which is the energy, I guess you would, and then the hertz, the frequency. And this allows us to dial to where we need to be in the tissue. We want to treat the penis and even the perineum, the area around the prostate, in order to open up the blood vessels as well as regenerate new tissue. So some men are fast responders. Guys with mild to moderate changes usually see a change in their erectile dysfunction after the very first treatment, and that's because we're opening up the blood vessels. Some men who have real severe erectile changes have more of a delayed reaction, which means that in addition to opening up the blood vessels, we need to generate some actual new tissue. We need to generate some new blood vessels. Now, this technology has been studied in Europe for 15 years, so that's exciting. We have 15 years of scientific data that shows the effectiveness of this treatment. In fact, the literature says that it is 85 to 92% effective at reversing erectile dysfunction. I don't know of anything else that can make that claim. Platelet-rich plasma is awesome. I've been using it now for 6, almost 7 years. It's a regenerative tool that helps to stimulate, again, new blood vessels, new nervous tissue, so you have improved sensitivity and improved erectile quality. And this tool right here is additive to that. So you can either use just PlateletRich Plasma, just the gains wave, or both together. And that's where I find the magic happens. When I'm able to help a guy with treating the underlying cause. So from a functional perspective, I typically do a bunch of labs, figure out, are the blood vessels dilating and contracting? Is there some underlying issue, like even a thyroid issue? A lot of times these subtle thyroid issues are not diagnosed, and that can be really interfering with sexual function. Is there a hormone imbalance? I could talk for days about hormones and replacement of hormones because it's an art. There's a lot of people out there just injecting testosterone or prescribing testosterone, but they're not understanding the subtleties of the balance of hormone in order to get to appropriate erectile function. So all kinds of tools, platelet-rich plasma, different compounds that help to, again, open up blood vessels, that help to stimulate arousal, like oxytocin, for instance, which is a hormone from the brain. I can actually prescribe that to help. So there's many aspects of erectile function or sexual function in general. We have tools that can address each and every one of those aspects, and this gains wave adds significant value to, again, getting erectile function on board. So it's a series of 6 or 12 treatments, typically done 2 a week. We can do this 3 a week, we can do it once a week, we can do it once a month. It really all depends upon your desire and availability. Once we get you to your goal, it's amazing to do this once a month or even once a quarter, because we're now continuing to add benefit and to keep those blood vessels open. So lots of different protocols depending upon what your goals are. I have some men that are on a performance goal. So once we do a series of 6, for instance, and they're really feeling very confident, we will then go to once a month. Occasionally we'll add platelet-rich plasma. I have a set of men who are really interested in reversing and then maintaining good sexual function through their lifetime. So after a series, we do 1 a month of the gains wave, and we do a quarterly platelet-rich plasma injection. All the while, I'm balancing their hormones and they're living a healthy life. These guys are going to have amazing sexual function for years and years. So I love to keep you updated on the technologies that we do have. Don't be fooled by just one technology to fix one problem. It's really important to understand the entire problem so that an appropriate protocol can be designed for you. But this gains wave is just one of the most exciting things to have happened in sexual medicines since platelet-rich plasma, since Viagra. And I think that we're going to see a lot more data coming out of the United States as the U.S. Scientists and physicians are studying this technology. But 15 years of solid medical peer-reviewed data has been published out of Europe showing the effectiveness of this tool. So join me at Dr. Studio. You can go to drstudio.com. You can call the office 561-444-7751. Book a consultation with me. We can do a phone call to talk about what your challenges are. You can come on in and visit me in person. And my real gift is designing protocols that use all of the tools that I have available to fix your issue or to enhance your life. So I look forward to seeing you. Thank you.